thank you for asking us, and thank you for your interest in this subject. And how I got to speak on transgender uh, female to male breast reduction, or top surgery as we call it, is I asked the chairman of that session, Samir Pancholi, if he needed help with any talks. And he said, well, Dr. Mandell-Brown, as a matter of fact, I need somebody to speak on this transgender breast female to male surgery. So he gave me about 2 weeks notice, and I had to get a talk together. So that's like in the media business, them saying, okay, go cover this talk, and you've got 24 hours to make your plans. That said, this is a very rapidly expanding field. There is an explosion of people who are more comfortable with their gender desire and transformation. And Cincinnati, where I live, Cincinnati, Ohio, is Mark Twain once said, if the world stops, you should be in Cincinnati, Ohio. And somebody said, why is that? He said, because everything happens 5 years later. So
Yeah.
that said, we're seeing increased demand on patients who want to change their gender and to be comfortable instead of wearing binders around their chest to flatten their breasts. They're having breast reduction top surgery. And so the talk was basically the different techniques that are used, and to give some information to our cosmetic constituents on the different options that are available for these folks. In general, they tend to be very grateful patients. And in some of them, I will say, have been, as a physician speaking, sometimes what I view as maybe being taken advantage of. And so by that, I mean, they'll go to the West Coast or the East Coast where they have multiple procedures done on their face for rhinoplasty, for forehead shaping, for facelifts, as well as the body surgery. And the fees that they're being charged is like, oh my gosh, that's a lot more than we charge here. So realistically, what we're doing is we're reducing the breast. And there's different ways of doing it. And as a conservative surgeon, cosmetic surgeon, we like to approach it in a stepwise fashion. And so we talk about breasts that have perkiness, that have sagging. And we grade sagging, or ptosis, we call it, breast ptosis, into 3 categories. Category 1 is where your nipple, if you put your finger under your breast and you put your finger right at that crease, your nipple should be on or above that line. So class 1 sagging was where the nipple is on that line. Class 2 sagging is where the nipple is below that line, and class 3 sagging is where it's pointing to the ground. Then you talk about the size of the breast. So if the patient has a smaller A, B cup, maybe even a small C cup, and no sagging, no ptosis, a lot of times I recommend just liposuction alone. And liposuction alone can reduce the breast. And if they have a larger areola, then we remove some of the areola itself in a circular fashion. And we make 2 incisions, an outer circle and an inner circle, remove the excess areola or breast skin, and then close the outer circle to the inner circle. So that is minimal scarring. And that's what we're trying to achieve for these patients. So if they have a smaller breast, liposuction alone, or if they have a smaller breast with a larger areola, liposuction with a circular lift. Now, there's some technology that can be helpful. And as a disclaimer, I don't have any interest in this, but we use Renuvion. And Renuvion, when it first came out, was called J Plasma. and it was made by the Bovie company, who's been spun off, and it's called Apex now, APYX. Well, their Renuvion is a helium plasma energy with radio frequency, and this gives very focal pinpoint heat under the skin. So whereas lasers will treat things from the skin downward, the surface downward, this is treating it internally. And so we will use the Renuvion in combination with the liposuction, and often that will shrink the breast down and reduce the breast to be more compatible with a male breast. And again, these are minimally invasive. We're talking about 2 millimeter openings, a couple on each breast. So you can do liposuction alone, liposuction with the Renuvion, and or reduce the areola. Now, if they have larger breasts, I'll often do what I call a two-step procedure, which is just what I outlined, and we see how much the tissues contract. And then I'll tell the patient, you know, we haven't burned any bridges. Let's wait about a year and see how you look. And I'd say about 80% are happy with the one stage. But if they aren't, then we can go back in and further fine tune with further liposuction or further reduction around the areola in a circular fashion. For the patient who has a very large breast, that would be sagging or class 3, where the nipple's pointing to the ground and below your inframammary crease, or where you hold your finger under your breast at that breast crease and your nipple's below that, and it's pointing to the ground, and they have a larger pendulous breast, say maybe a D or double D. On those patients, we do what we call a double incision technique. And the double incision technique is where we make an incision along that breast fold, along the inframammary fold, and then we have the patient flex, and wherever the upper portion of that flexing that shows you where the border of the pectoralis muscle is, you make a separate incision there and remove that tissue between those two horizontal lines. Now, where the nipple is for a male is a little different for the female. For the male, it should be, if we divide your collarbone into thirds, it should be between the middle and outer third, and it should be just at the border of the pectoralis muscle. And it should be about maybe 2 centimeters wide, as opposed to most females, which are about 4 centimeters wide. So the male nipple or areola nipple is much smaller. So again, a stepwise approach, minimal scars, and the patients have a very high satisfaction rate. And so I took the audience through a few case studies, and it was interesting. We had one patient who was transitioning to a male, and we did the breast surgery, the top surgery, and the patient had so much confidence that they became president of the student union at their local college. And so that it was amazing to see, and they were written up in the newspaper, and they were very proud. And so that transition and transformation was very gratifying as a cosmetic surgeon. Another patient also showed kind of what you have to be careful with, and we'll have all patients be cleared by their treating endocrinologist or their psychologist, because I want to make sure as a surgeon that this is really good for them, and emotionally they're ready to have this change. And so this next case study was a patient who was male and decided to become female. And the patient went to San Francisco, where there's a famous surgeon, transgender surgeon, and for about $150,000 or $200,000, you can have your forehead slope shaped, you can have your thyroid cartilage shaved down, you can have a rhinoplasty and a facelift, and that is exorbitant. And I told the patient, oh my gosh, I wish you had stayed in Cincinnati. We could have done that, and not for $150,000. But be that as it may, the patient came to me for breast augmentation. And I always say it was one of my best breast augmentations. They looked fantastic. they're very happy. And then about 2 years later, they decided to change back to a male. And so now I'm doing breast reduction surgery. And by that, I mean, it's not just taking out the implant because the patient's tissues had stretched in the meantime. So we had to do some liposuction and one of those circular type lifts. And so, in general, the 99% of our patients remain with the gender that they have transformed.
Mhm.
And this is one patient who reverted back. So again, looking back through our records, we had clearance through the psychologist and the endocrinologist, and people have changes. They make changes in their life in every aspect.
For the surgeries, what kind of adverse events are you seeing, side effects, anything that you're seeing after surgery that should be watched out for?
Well, so it's with any breast surgery. Um, we talk about avoiding aspirin and Advil and fish oil, vitamin E, because all those affect your platelets and promote bleeding. There's some techniques where doctors will put drains in because of postoperative bleeding. I always feel it's better to have meticulous, what I call hemostasis or meticulous blood control. And so we don't use drains with our technique. But bleeding is a problem, a potential problem. Nipple numbness, again, with these superficial cuts, the chance of permanent nipple numbness is extremely rare. Many of the articles in the literature talk about doing what they call a free areola or nipple graft. And with a free areola or nipple graft, you're actually taking the areola off, setting it aside, reducing the breast, and then sewing it back on with what we call bolster dressing. And the bolster dressing holds it in place. Well, those patients, 100% will never get feeling in their nipple. It'll just be a dead zone. Now, it's a small in a male, larger in a female, but I'm always trying to conserve tissue. And so we try not to do the free nipple graft if possible. But that with that technique, you do have 100% loss of sensation. Um, Scarring is the other big factor. And so anything we can do to minimize scarring is very important because not only are we downsizing, but we want to make sure that we don't create scars that can be really disabling to the individual after the surgery. So we don't hear, gee, my breast is flat now, but I have all these scars on my chest. We want to keep it as minimized as possible.
And are you seeing that you were just talking about people going to the West Coast or the East Coast to get these exorbitantly priced procedures? Are you seeing that even in Cincinnati that this is a little bit cost prohibitive for
Uh,
people who are needing this?
it's all relative, but I think the prices are pretty reasonable. For example, to liposuction the breasts and to do the Renuvion, maybe $6,000, $7,000, $7,500. It's not cheap, but it's not, outrageous in my mind compared to what I see prices around the country. If we do the concentric reduction or that circular lift, that can add a few. So you're talking about $10,000 or $11,000,
Mhm.
but it's not 50 or 75,000 that I'm seeing.
Yeah, yeah, that's definitely a big difference.
Yeah, and I think sometimes, and I think that sometimes people feel like, oh, I better go to quote the guy who's been on social media or the gal who's been on social media, and they're the ones I want to go to. And I think that the patient, the people who read your articles and see your media should one look at their results. I think two, look at the cost. And three, I always say, not that they're doctors, but it should make sense.
Mhm.
So if they're advocating something, recommending something that seems like over the top, uh, for your top, I think you should beware. And I think it behooves a person to get a few opinions. And it's like everything. Sure, we saw a patient earlier today who did some what they call medical tourism, where they went to another country, and those prices may be really cheap in comparison. But then when the patient comes back, who's going to take care of you? And in most locales, the doctors feel, if I'm not good enough to do the surgery, don't call me to take the stitches out and deal with your infection or your scar. We do. We're happy to see anybody, but you do want to be careful. So it's not just the price and the surgery; it's the aftercare that is really just as important.
And are you seeing in your patient base that is coming in for these kinds of procedures, is it younger people? Is it older people? What are you seeing?
I'd say the average age is about 26 to 38.
Mhm.
So we're not seeing um, the elderly over, over 50, 60. And we'll also see some people in their 20s. The 20-year-olds, I'm actually doing more male to female, where they're getting breast augmentation.
Mhm.
And that stands to reason with that age group. So females come in that age group seeking breast enhancement, and the males who are becoming females also seek that in that same age group. But for the transgender breast reduction or top surgery, I'd say the average age is in the late 20s, early 30s.
And it's interesting because I think that some of that, the younger patients that are coming in, it makes me happy because it makes me think that we're being better as a society and people feel more comfortable being themselves. And I think that it's also got something to say about the way that the newer generations have been educated on plastic surgery, on cosmetic surgery, and the different options that they have. Because obviously, back in the day, there wasn't as many options, and a lot of the time, these weren't issues that were being talked about.
Right. So this was an entirely taboo subject. And if you had a gender identity that you were interested in altering, it was just something that you could not bring up to pretty much anybody in your family, your clergy, anybody just didn't want to hear it. And so I think it is better as a society that these people have the freedom, these patients have the freedom to make the change if they want. The reason we find out that get them cleared with a psychologist is because I only know them on a shorthand basis. And I just want to make sure that somebody who's been following them feels that this is a good time to proceed. Because again, the social media and YouTube sometimes promote these procedures as drive-through surgeries. And they're not. You have to really be, even if everything goes beautifully, there's postpartum depression when you have a baby. There's postpartum cosmetic depression after any procedure. And we just want to make sure that everybody's aware of all that.
Yeah, well, I think it's has something to say that a lot of people in those majority groups also do struggle on a higher level, a higher amount with mental illness because, I mean, it's just a harder life. Let's be real. Like it is. It's a harder life. They're more likely to meet violence and people not understanding them. So I think that that's definitely within um, reason to just check with their psychiatrist or therapist to make sure that it's the right time for them to take that jump because as you were saying it's a big deal.
It is. And I always say that when you're ready to do something, you can do it. But like the one case study that I presented to the audience where we switched back and forth, it's not the end of the world, but they spent a lot of money, a lot of surgery, a lot of recovery, and they ended up at the same point where they started from on their journey. and that's what they needed to do. But you know, maybe had we waited a little bit, and are you sure you want to do this? But that's all retrospect. But I would say that's not the case. Most of the patients really, they know what they want, they have a clear idea, they're ready to make the change, and they have to find a healthcare provider who's empathetic with them and a healthcare team. And this is important because we have our own surgery center. So the patient has their privacy. We are state accredited. It's one room operating room. But we had an anesthesiologist who was doing a breast augmentation on a male to female patient of ours. And afterwards, he told me, I'm never coming back here again, Dr. Mandell-Brown. I said, why? This is against my religion. And I'm thinking, oh my gosh, it's 2000. It was 2008 at the time, 2020, maybe 2017, I forget. But I said, you know, our job as healthcare providers to take care of people and not impose our religious convictions. But he felt very strongly, he said, I'm not coming back. You do these, and I can't, I don't condone it. I don't want to be a part of your health team. So I think making sure that everybody feels committed to helping folks, and it can be anybody, not just transgender patients.
Yeah, definitely. There's been a larger discussion about health equity and making sure that everyone feels represented and taken care of in healthcare. And that has been a problem in the past. There's no way to get around that. And I think that it's so important to have these discussions and really bring different perspectives out into the open, and to have that help with the procedure guidelines and what other people are doing to help these patients, because it is a more taboo subject for a lot of people still. And we've moved a lot further in society, but it's still not perfect. So having to have those discussions with medical staff to make sure that it's an inviting environment for all kinds of people to come in, like you said, I think is really important.
So, and I think that that's a key point. And I think that as 2021 and the future, I think more and more people will be pursuing these types of procedures. The numbers are increasing every year, probably by about 20%.